Hi there, it's Tim, the exercise physiologist here at Executive Medicine. In addition to being an exercise physiologist, I also am a qualified nutritional coach and provide tips to our clients to help improve their overall health and well-being and try and prevent the development of health conditions and illnesses. So when we look at diet, we want to try and make it as simple as possible so people can implement strategies to improve their eating habits and therefore their overall health. So what we do, we go through a checklist, and this is done by myself or the doctors here, that looks at someone's diet compared to healthy eating habits, and also we also implement some of the principles from the Mediterranean diet because we know the Mediterranean diet is the best type of diet from a health and well-being point of view, and it can reduce someone's risk of heart disease and stroke by about 20 to 40%, but also it can help reduce the risk of cancers and diabetes and metabolic conditions and other types of health conditions that we don't want. So if we bring up this slide here, this is the checklist that we go through with our clients. And the first one we look at is how many serves of vegetables and salads someone is eating per day. So we want to see at least 5 per day ideally. And when we mean a serve, if that's fresh salad, that would be a full cup of salad. And if it's cooked veggies, it would be about a half a cup. And then if we look at fruit, we probably want 2 serves per day, maybe 3 serves per day. But the main thing with vegetables, salads and fruits is that we have them regularly and in different colors and varieties, so we get all the different vitamins and minerals into the body to help our body function appropriately and healthily. Then the next question we look at is how many standard drinks of alcohol someone is drinking. The Australian guidelines would say less than 10 standard drinks per week, so that's what we use, but there's probably no safe limit for alcohol. And the main reason we want to keep alcohol on the lower side is that we know it's a cancer risk. We know that when you drink too much alcohol, or any alcohol actually, in fact, that the body will use that as an energy source straight away, so we don't use our fats, our carbohydrates, or our protein for energy. It also can reduce the absorption of fat and particularly fat soluble vitamins, so the A, D, E, and K vitamins would be reduced. So that's the health reasons why we don't want to have too much alcohol in our body. The next question we look at would be how much fish someone is eating per week, and we particularly want to focus on oily fishes, so things like salmon, sardines, mackerels, and probably at least 2, maybe 3 serves per week would be ideal. And that's really important because we know it can reduce the risk of heart disease, and it helps reduce inflammation because it gives us all our omega-3s that we can't make in our body. The next question we look at would be legumes. So legumes would be chickpeas, lentils, kidney beans, red beans, black beans. They're really high in fiber, and we probably want 2 to 3 serves per week, but also a really good source of protein as well. The next question we look at would be nuts and seeds. So again, we want to see that pretty much someone's having nuts, seeds, whole grains pretty much every day, but at least 5 times a week. And I guess looking at legumes and vegetables and salads and nuts and seeds and whole grains, they're all high in fiber, and fiber is really, really important because it is really beneficial for gut health and keeping our bacteria in high numbers and also healthy numbers, but also it can help reduce someone's cholesterol, particularly the bad cholesterol, which is the LDL cholesterol, because fiber can help that remove LDL cholesterol in our bowels and reduce the lipids in the body. The next question we look at would be what type of oils an individual is using to cook with or eat with, and the 2 best we look for would be extra virgin olive oil or avocado oil. The next question would be how much meat someone would be having. So it could be red meat, so like pork, veal, steak, lamb, minces, but also processed meat, so all the deli meat. So we want to see someone having less of those type of meats if we can, maybe no more than 3 serves a week, but less is better. The next question we look at would be how many discretionary sweets someone would be having, so like pastries, soft drinks, ice cream, potato chips, These again should be limited in someone's eating habits because they can increase lipid profiles and significantly increase the risk of heart disease, which we don't want. And the last question we look at would be how many serves of calcium-rich products an individual would be consuming in their diet for their bone health. So that would be like milk and yogurt and cheeses, or if they're having plant-based alternative milks such as like almond, oat milk, soy milk, making sure those products are fortified with calcium and that someone shakes the bottle quite well before they use them. So these are the diet principles we try and encourage with all our clients here. And over time, people can implement strategies to improve their eating habits. So they worked over a period of time to improve their health and well-being. If someone needs more help or they have a medical condition, then we definitely refer those people on to appropriate dietitians or clinical nutritionists, or the doctors here would also assist with their diet. But if you do need any assistance with your diet and eating habits, please contact us here at Executive Medicine, and we are happy to help you out to try and improve your health and well-being. Thank you.